Ebola, but there is another virus out there, and it's targeting kids across this country. In fact, 46 states now have confirmed cases. So the family physician, Jennifer Caudle, who says that's the virus that we really need to be worried about right now. Tell us about the virus and why it's not getting the type of attention it should.
Well, you know, there are a lot of things going on right now in the news, and honestly, it is very important to be talking about Ebola and everything else that we're talking about, but enterovirus is still out there. The Enterovirus D68 virus is a particular strain of enterovirus that's causing, in some cases, very severe illness among children. Some of them have needed to go to the hospital, some of them are having trouble breathing, and it's definitely important that we talk about this with parents in the community.
Doctor, where did this virus come from? It seems like yes, it was under the radar in large part because of Ebola, but it seems to have come out of nowhere and it's spreading up very quickly.
You know, that's a really good point. You know, enteroviruses as a class occur pretty much every year. They cause upper respiratory infections, millions of infections every single year. But this enterovirus D68 strain, this is something that we haven't seen very much. It was discovered in 1962, but since then we haven't seen it very often. And this particular season, we're seeing a lot more cases. And as you mentioned, yes, it's affecting children most likely, most commonly, and especially those who have underlying lung diseases like asthma.
For parents who are watching, they're really afraid now, they're nervous. What are the symptoms? What are we looking for? How do we detect it quickly?
Well, I think one of the most important things to know is that the enterovirus D68 strain causes illness that ranges. Some symptoms are very mild, almost like the common cold, things like runny nose, nasal congestion, fever, muscle aches. But some of the symptoms can become very severe, and that's when we're talking about the asthma, the wheezing, the shortness of breath. You know, this is what I say to a lot of parents of my patients. If you're worried about your child, I'm probably going to be worried about them too. But a few other things. If your child, if their fingers or if their lips are turning blue, if they're breathing at a faster rate than they normally should be, if they're flaring their nostrils, almost in trying to get more air in, or they have what we call retractions. That means their chest kind of caves in at the end of respiration to try to get more air in. Any of those signs are certainly an emergency and warrant emergency treatment. But remember that this condition ranges. Many and most people will have mild symptoms. Some, though, will have the severe symptoms.
Dr. Caudle, thank you very much. We appreciate it. And now we